Hi, I'm Dr. Lyons with Advanced Chiropractic and Rehab. I'm here with my patient, and we're going to go ahead and talk a little bit about pregnancy and chiropractic. This is one of those conditions that comes up quite a bit. I see, and I've treated many pregnant women over the years who have come in for routine care and back pain related to pregnancy. It's interesting, I always say it's one of the only treatment options pregnant women really have. They can't take medications, and a lot of other things are not very good for mom or the fetus. So they make their way into the chiropractic oftentimes as a first visit. I've taken a lot of joy in treating pregnant women because we usually have a tremendous impact on the changes that their bodies go through. One of the things that pregnant women have to deal with is obviously more added weight, which increases compression in the spinal column, along with overworking postural and spinal erector muscles, causing a lot of muscle spasm. A lot of times in the thoracolumbar area, right? Mm-hmm. And even down in the lumbosacral area down below. So what I wanted to do today was just demonstrate how we adjust somebody who's pregnant. She's just gone into third term, and this is where the baby will grow, I think something like 30 or 40% in the last.
A pound every 2 weeks or something.
Right, yeah, it's usually where they put on the vast majority of their size and weight. This is a lot of times where pregnant women have the most problems. I have treated pregnant women all the way up to full term within a couple of days. And I always tell them it's a good idea even to return after the post pregnancy, because their bodies now are going to start adapting back to the way that they were. And whenever you have rapid change to the body, which 9 months is pretty rapid change, and then they have to change back, you're talking about an 18-month period of time that your body fluctuated, 30, 40 pounds sometimes, up and down. And it gets further complicated because women who can end up with mechanical pain as a result of the pregnancy that goes unresolved after the pregnancy might not fully resolve or go back. And then there's a growing baby that they're caring for, picking up, carrying around in the nice little carrier out here that weighs 20, 30 pounds, sometimes more. And that all leads to chronic and problems with low backs. And I don't know, I've treated a number of women over the years that I've traced their beginnings of their back pain back to pregnancy-related back pain. And a lot of that can be avoided. It's very safe for mom and the fetus. There's been several studies done on it. It's shown that it helps the baby to turn earlier and easier. Women report less pain and problems with childbirthing as a result. Obviously, it helps to loosen up the ligaments of the pelvis and the lumbar spine. So there's a lot of good benefits from it. We do have massage therapists on our staff also. That's another treatment that is highly effective in helping relieve a lot of the tension in the muscles related to pregnancy. And usually we couple the two together, some kind of soft tissue work and with manipulative therapy. So I'm going to go ahead and get to it and demonstrate. I do have a special table just for this. We do have a thoracic breakaway on our tables, and that allows the patient to be on her belly a little bit more comfortably. And we can do this mostly up through the third trimester, but it gets a little difficult as she nears the end, and a lot of times I won't have my patients lying flat at that point. So what we're going to do, she's got a little bit of tenderness in here, right? Mm-hmm. And down in here in the low back. Mm-hmm. Okay. Your muscles up in here feel pretty good. Has this been bothering you?
No.
Okay. All right, so we're going to do a simple side posture adjustment. I'm going to have you lie on this side. I'm going to put the table back up, okay? All right. Cross your arms, and I won't drop you off the table, I promise you. It always feels like it because we kind of roll you forward a little bit. I want you to take a deep breath in, and let it out. Okay. Is that all right?
Mm-hmm.
All right, let's try the other side. Okay, take a deep breath for me, and then let it out. Okay. Last one, I'm going to have you go ahead and lie on your back. Go ahead and slide down just a little bit. There you go. Now I'm going to get your thoracic spine and some of those tender points in there. So I'm going to cross your arms, pull forward. Let's take a deep breath in, and let it out. All right, come on up. And that was pretty much it for a low back adjustment and your thoracic spine. Was any of that painful or uncomfortable? Does that generally feel a little bit better?
It felt really good.
Okay, good.
Can't do that myself.
No, you can't, unfortunately. I tell people all the time, if I could self-adjust myself, I would as a chiropractor. It's something that has to be done with two hands and obviously with somebody who understands and has some skill. So anyway, we'll continue to treat Danielle here up through her third trimester and hopefully see her back afterwards, and hopefully mom and baby are all healthy and safe.
Thank you.
Thank you.